In our profession, we see a lot of elderly people suffering from congestive heart failure. Dr. von Schwarz, can you explain to us what congestive heart failure is?
Congestive heart failure means that the heart muscle is somewhat weak. The heart is a muscle, and the muscle contracts and pumps blood from the heart into the entire body. In congestive heart failure, that muscle contractility is reduced, meaning the heart muscle becomes weak, and as a result, the cardiac output, meaning the liters per minute the heart is pumping into the body, is reduced. The reasons for congestive heart failure could be manifold. There could be lack of oxygen as a result of coronary artery disease or heart attacks in the past, but it also could be the result of a disease of the heart muscle itself. We call this cardiomyopathy, for example, as a result of virus infection, among many other causes. Some medications, drugs, can cause weakness of the heart muscle. So as a result of congestive heart failure, patients oftentimes have several symptoms, such as shortness of breath, because there's a congestion of fluid in the lungs. The lungs fill up with water basically, and that causes shortness of breath. In addition, patients can have water accumulation in the extremities, in the legs, for example, or in the stomach. They feel bloated. In addition, there's a lot of fatigue, weakness, reduced physical capacity as a result of congestive heart failure. In general, congestive heart failure is a chronic condition, and in most cases it's a lifelong condition, and it leads finally to death. Fortunately, we have a lot of options nowadays to treat congestive heart failure by use of different medications, by reduction of salt and fluid intake, as well as by surgical options and electrical therapies. Congestive heart failure needs to be diagnosed, and we need to know what the reason for it is before we start the treatment. It's almost a pandemic condition. There's more than 6 million people in this country alone suffering from congestive heart failure. Approximately 250,000 people die every year of congestive heart failure, and almost 500,000 people are newly diagnosed every year with congestive heart failure. In the past it was mainly a disease of the elderly, but now we see a lot of younger people with virus infections, even COVID, but also other virus infections can lead to congestive heart failure. So it's a serious disease. If you have symptoms such as shortness of breath, extreme fatigue or weakness, you can't breathe, or edema, swelling in the legs, bloated abdomen, talk to your doctor, get a consult from a cardiologist, have your heart evaluated.